What's up, everyone, and welcome back to For the Love of Surgery, Textbook Edition.
I'm the greatest in the game. Everybody knows my name. Put your hands in the air, fellas. And all the ladies do the same.
In today's lessons, we're covering Chapter 5, the Physical Environment and Safety Standards. Up to now, we focused a lot on the people, the patients, their needs, and how to care for them. But this chapter really hones in on the environment you'll be working in every day, the operating room. In this video, we'll explore how the surgical suite is set up, what hazards you'll need to watch out for, how waste and sharps are handled, and the regulatory agencies that make sure everything runs safely and legally. So let's go ahead and take a closer look into the whole physical world of the surgical suite. So the surgical department isn't just a random collection of rooms, right? It's a carefully designed, controlled environment that's divided into zones to minimize infection and streamline workflow. Now, there are 3 zones you'll need to be familiar with. One is the unrestricted zone. This includes the locker rooms, offices, and public hallways. So your street clothes are allowed in these areas. 2 is your semi-restricted areas. And you can think of the corridors leading into the operating room. You'll need scrubs, hair covers, and usually designated footwear. And lastly, zone 3 is the restricted zone. This is the actual operating room and scrub area. In addition to your scrubs, you'll also need head coverings, your mask. Sterile technique is actively being practiced and monitored in these areas, so you want to make sure you're fully covered. The whole purpose of these zones is to control traffic and prevent contaminants from making their way into sterile environments. So inside the OR, every component has a purpose and is positioned for safety, sterility, and of course efficiency. So let's break that all down. So your core components include the surgical table or surgical bed, which is adjustable and designed for positioning. You will assist with patient transfers and support. Next, you'll have your OR lights. And although they're not as pretty as these, they're high intensity and adjustable to focus directly over the sterile field. When a procedure has already started, the only people that should be reaching and adjusting those lights over the field are the surgical sterile team. You also have your anesthesia machine, which is positioned typically at the head of the bed, and that's where your anesthesiologist or nurse anesthetist will monitor the patient's vitals and manages all the medications. Then you have your back table and Mayo stand, which is yours or my workstation, and that's where you'll organize your sterile instruments for easy access during the entire procedure. You'll also have your suction and electrosurgical units, your ESU. These are tools for maintaining visibility and controlling bleeding while you're doing the procedure. Understanding the whole layout of the operating room really kind of helps you anticipate the surgeon's needs, manage your sterile field, and also move around with confidence. Now, if you've never been in an operating room before, I can tell you that it is full of equipment. But with that comes high risk. So some common physical hazards that you can prevent in the OR include slips, trips, and falls, of course, because of wet floors and tangled cords that just line the floors. Struck by injuries from moving equipment like the booms or the light arms and things of that nature. Back strain from improper lifting and patient transfer. Make sure you're always taking into consideration your body mechanics. It's very important, guys. There's also electrical hazards from damaged plugs or exposed cords that people just kind of want to tape up and push to the side. I always suggest to organize your cords and your equipment in the best way as possible. And if something doesn't feel safe, make sure you speak up because you want to prevent anyone on the team from getting injured. A large form of exposure in the OR is, of course, blood and bodily fluids. This is a big risk. You're in the front line of being exposed to these things. So let's talk biological hazards, which could include bloodborne pathogens like HIV, hepatitis B and C. There's aerosol fluids during procedures and newly soiled contaminated instruments. Make sure you properly wear your PPE correctly and consistently. Make sure you're properly following hand hygiene and gowning and gloving procedures. Go ahead and always report needle sticks and exposure incidents immediately. It's also frowned upon to recap needles. So although it is seen quite frequently, it's not best practice. And by not doing it, you can avoid possible injury. If we're being honest, safety starts with the surgical tech in the room, and the standards you follow protect everyone. Whew, sharps. They cause some of the most common and most preventable injuries in the operating room. Some key practices could include using a neutral zone or a no hands passing technique for scalpels and needles. Always dispose of sharps immediately in clearly labeled containers, so not just in a regular trash can. You want to make sure you use tools, not fingers, to remove and load blades. And never leave sharps on the field unattended. Sharp safety isn't just about your self-protection, it's about creating, again, a safe environment for the entire team. Now, with medical waste, it must be sorted and handled properly. This includes biohazard waste like soiled sponges, drapes, and gloves. And you also have your sharps, like I just mentioned. And then your pathological waste, like your tissue and body parts. And then chemical waste, like cleaning agents and things like that. All of them must be disposed of in clearly labeled containers following facility and OSHA protocols. Improper disposal can lead to contamination, injury, or regulatory fines. So make sure you know your policy and follow it without shortcuts, please. You know, chemicals are everywhere in the OR, from the disinfectants to sterilants to surgical smoke. And exposure can cause burns, respiratory problems, or even long-term health issues. So things you want to be aware of is glutaraldehyde and formalin, which is used to preserve specimen. Of course, your surgical smoke from the electrosurgical units, like the Bovie, that requires evacuation. That's a whole nother conversation. And also latex. A lot of facilities are actually latex free, but allergies are still a high risk. So your role in all of this is to read the material safety data sheets, or the MSDS, when handling different chemicals. You want to ensure proper ventilation and protective gear is being used. And please never, ever mix chemicals unless you are specifically trained to do so. When in doubt, just ask. That's the best way to go about it, because chemical exposure isn't something to be played around with. It really ain't. Okay, so there are several different agencies that set the standards that govern safety in the OR. And you don't have to memorize every detail, but you do need to know who these key players are and how to find the information. Now, OSHA, they protect workers by enforcing safety standards. Then you have the CDC, which provides infection control guidance. Then you have the EPA, which regulates disposal of medical waste and chemical waste. Then, of course, you have the beautiful Joint Commission, and they accredit hospitals and ensure compliance. Then you have the NSI and the AAMI, which provide technical standards for sterilization and equipment. And as a surgical tech, you're expected to uphold these standards daily, because safety is not optional. It is your responsibility and everyone else in the OR. So what did we learn today? Chapter 5 reminds us that the operating room is more than a place. It's a highly controlled, highly protected space designed to keep both patients and surgical team safe. From physical and chemical hazards to sharp safety to biological exposure and regulated waste disposal, this chapter teaches us that vigilance is a daily habit, not a one-time protocol. As a surgical technologist, your situational awareness is a skill, your compliance with safety standards is a responsibility, and your attention to detail, that's how you protect lives every single shift. So, in the next chapter, we'll step into the intersection of technology and surgical science with Chapter 6, Biomedical Science and Minimally Invasive Surgery. We'll explore how computers, robots, and advanced imaging are transforming the surgical field, and also what that means for your role, or my role, in the operating room. So make sure you're subscribed and hit that notification bell so you can join me next week on Chapter 6 as we uncover the tech that's reshaping surgery from the inside out. I'll see you next week. Bye.
I'm the greatest in the game. Everybody knows my name. Put your hands in the air, fellas.